Whether you're feeling sick or you've been injured, it's sometimes difficult to decide when is the right time to go to the ER. Perhaps you should just go to a walk-in clinic or call a doctor, but how do you make that choice? Kathleen Williams joins us now. She's a critical care nurse at UConn Health Center's emergency department, and you're here with some very helpful tips, Kathleen.
I hope so. In response to the question of when should you go to the emergency room, anytime that you feel that you may need a doctor, you're unable to get a hold of your primary care physician, if you have any issues that go from the acute to the critical to the minor, please don't hesitate to go to the local emergency room. We will treat anything from a minor injury to minor illnesses to anything that would even be upgraded to warranting admission to the hospital.
Okay, I mean, I know the big concern, I know for me, wait times is a big concern. And it's hard for you all to say, okay, come in now, we'll see you then, because you can be a high priority. Someone else walks in and then they become a high priority. So how do you determine which patients are seen first? Is it just by matter of emergency?
When you arrive at the emergency room, you'll be seen by a triage nurse, and that's universal to all emergency rooms. And to triage means to sort. So at that point in time, you will come in with your chief complaint. You'll get a set of vital signs. You will then be able to piece it together like you would a jigsaw puzzle. How many patients are already there in the emergency room? How many beds are available at that point in time? How many exam areas are available at that time?
Okay, what should you bring with you to the doctor's office, or to the emergency room, I should say? Anything that you should have handy to make things easier for the nurses?
If at all possible, and if it's a routine visit, or even if you're coming by ambulance, if at all possible, we ask that you bring a picture ID, an insurance card. These help us expedite safe patient care in as much as we can cross-reference medical records, as well as, most importantly, a list of your current medications, a list of allergies to medications, all help us to expedite care. In the event that you don't have it, don't fear. With today's technology, we're able to still provide safe care in an expeditious manner by locating medical records for you.
Kathleen, you mentioned ambulance. So when is it okay to drive yourself, and when should you call an ambulance?
We beseech that you call the ambulance any time that you feel compromised in driving, or that driver may be compromised. You may feel a sprained ankle doesn't warrant an ambulance, but I use as an example, if that ankle happens to be your braking foot, your gas.
So use some common sense.
Exactly.
It's hard, though, because you're panicking already.
And a lot of people feel that unless it's life-threatening, they don't want to dial 911. But our paramedics bring the ER to you, plus provide safe, expeditious care to the hospital. And it ultimately will provide safety for you and others that are on the road also.
Before we go, as a mom, what happens if there's an emergency with your child? I mean, obviously you have to put the child in, and let's say they're a baby, you know, or a 1-year-old, like my son. You would put him in the car seat and then just call them and then just say, let's go, or would you call an ambulance for? Ambulance
services have pediatric equipment to keep that child safe en route to the hospital.
Okay, anything else that you want our viewers to know, just to kind of clear the air and help people out, or I think we covered it all?
I think so too. Just know we're there, we care, anytime, 24 hours.
Kathleen, thank you so much. I'm sure you've seen a lot of things in your business, a lot of emergencies, but thank you for being there. I appreciate it. Thank you, Kathleen.